Oh, sorry. Well, welcome to this talk. Now, I want to play you a video clip from a Mr. William Gates, and then we'll think about what he said.
Making the mRNA is really easy and really cheap, and that's the magic of this thing. But there's no doubt in the next 5 years, we can, we just need to mess around. There's a lot of lipid nanoparticles, and some are very self-assembling. There's no inherent reason it's not thermostable, it's not cheap, and it's not scalable. And so as over the 5 years, we fix that part of it, mature it, which is very typical, we'll be able to build factories worldwide that can make $2 vaccines with even less lead time than we've had to have here during this pandemic. And we'll use those, as you suggest. For every disease that we don't have vaccines, we will try mRNA. In fact, for HIV, we have multiple ways, one that's more of a B cell approach, one that's more of a T cell approach. For malaria, we have multiple ideas. For TB, we have multiple ideas. And so to fill in the missing vaccines, we'll make a lot of our bets of the Gates Foundation and others who care about global health will be mRNA focused.
Well, quite an interesting talk. mRNA vaccines are easy and cheap, apparently. Well, you wouldn't think it was cheap from the prices being charged by certain manufacturers, pharmaceutical manufacturers at the moment, but we'll let that pass. But over the next 5 years, it looks like there's going to be a lot of money put into innovation of messenger ribonucleic acid technology. And lipid nanoparticles, he mentioned there, as far as I could hear, self-assembly. We're going to get self-assembly of these lipid nanoparticles. Now, quite what is going to self-assemble, I don't really know, and quite where it's going to self-assemble, we need a little more information on that. At the moment, I simply don't know. But this is scalable. This can be brought up to a massive scale with the maturation of the technology, scaling out to the whole world, worldwide factories, global domination, worldwide factories all over the place. Low lead time, in other words, they can identify something they'd like to make an mRNA vaccine for, and then they can make it really, really quite quickly. And they're going to have RNA for every disease we don't have vaccines for at the moment. Now, mentioning HIV, TB and malaria. Now, we could talk about vaccines that there are for all of these, but we will let that pass as well. But it looks like there's going to be a lot of innovation into these new vaccines. And others who care about global health will be RNA focused. So do you care about global health? Well, in that case, it sounds like you're going to be RNA focused. Now, this, of course, is quite incredible, and I expect you'll have some comments to make. Now, as far as I know, Mr. Gates he's not a doctor, he's not a nurse, he's not a pharmacist, he's not a biomedical scientist, he's not a nurse, he's not a dentist, he's not a physiotherapist, he's none of these things. Now, I don't want to be unfair. He may have experience as a hospital porter or even a hospital gardener that I don't know about, but he has no qualifications in these matters. So let me know how comfortable you are with people self-appointing themselves to lead global research on these topics. My big problem is this. When you give a lipid nanoparticle, these tiny lipid nanoparticles, billions and trillions of them, are going to go into the blood. Now, when I say into the blood, that's exactly where they go. We were told they stay in the arm. We now know that is not the case. They are systemically distributed. They go around the body. And they're lipid nanoparticles. They're fatty. They're fatty. Now, the membranes round about all of the cells in your body, are fatty. Phospholipid bilayers. So that means that these lipid nanoparticles will come into contact with the cells on the surface of your body, and the membranes will just fuse into one. Just a bit like those bubbles I was playing with actually at the start of the program that you caught me with when I was just entertaining myself. Let's just have a quick look at a quick clip of my bubble mixture and see if this helps us understand what's going on. So the lipid nanoparticles are a bit like this soap you caught me playing with. The nanoparticles, the particles, or the soap bubbles in this case, they just kind of link together. The membranes will bind and they'll become one, and they will absorb into any fatty surface throughout the body. And of course, that will mean they will discharge their contents into that cell. So obviously all demonstrations have their limitations, but I think it gives you the idea. The membranes, the lipid nanoparticle and your own cell membranes fuse together. That lets the RNA into your cell, where it can have various activities inside your individual cells, not restricted to the arm, anywhere the blood goes, anywhere in the systemic circulation, from your toes to your ears, to your heart, to your liver, to your kidneys, to your ovaries, to your testes. It can go anywhere. And we can get this fusion of these lipid nanoparticles, which may be self-assembling. So quite interesting new innovations coming along in the next 5 years. Let me know how comfortable you are with this type of global leadership that we seem to be enjoying at the moment. Let's have another clip.
When we look at vaccines, they were the miracle of this epidemic. They saved millions of lives, but they can be far better. We need to invent easier to deliver vaccines that are just a patch you put on your arm or something that you inhale. We need vaccines that actually block infections. In this case, there were lots of breakthrough infections. We need vaccines that are broad spectrum, so they work against most of the emerging variants, which we did not have this time. And we also need factories that are standing by so we can build enough vaccines for the entire world within 6 months and achieve far better equity. The vaccines can also do something that would be super helpful, which is to help us eradicate entire families of viruses. Innovative new vaccines used properly could get rid of the flu family, the coronavirus family. And there's a huge burden of those, even in non-pandemic years. And if we get rid of it, it can never cause a pandemic. And here's the best part of this. Even when we're not having an outbreak, these investments, like the Lamira, those new vaccines, they will make people healthier. They'll shrink the gap, the health equity gap, which is gigantic, between rich and poor countries. For example, we can detect more HIV cases and do a better job of treatment. We can reduce deaths from malaria. We can get more people high-quality care. And so this is not just a downer about how to stop things from getting worse, but also a chance to make things better. If we take the right steps, we can make COVID-19 the last pandemic, and we can build a healthier, more equitable world for everyone. Thank you.
Well, obviously they were just clips, and the whole talk does give a little more nuance and background, so do watch the whole TED talk for yourself, readily available online. COVID vaccines were miracles that saved millions of lives. I'm not quite sure what the data is for that, but let me know what you think. We need simpler vaccines that can be given via simpler routes to get vaccines into as many human beings as possible to block infection. We need factories for the entire world. We're thinking here on a global scale. Carrying on a global scale. I mean, my personal view on this is that all mRNA lipid nanoparticle technology should be completely, a moratorium should be completely put on it until we know what the heck's going on. Because at the moment I don't think we do, but Mr. Gates here is thinking about a vaccine factories for the entire world. You might find that idea completely terrifying. And this idea about eradicating families of virus to me makes no sense at all. Eradicating influenza viruses, eradicating coronaviruses. I mean, these are part of the ecosystem of the planet. They are in animals all around the world. They're in ecosystems all around the world. A few of them affect people. The idea that you could eradicate a class of viruses to me just sounds like, well, complete nonsense, to be quite honest. I really don't know what he's talking about for that particular point. There are billions of types of viruses out there, billions of types, trillions of types, not just viruses. I mean, how you could eradicate a whole class of viruses from the terrestrial ecosystem. And even if you could, would that be desirable? Because the key word I've just used there is ecosystem. These viruses are there for a reason. They're part of ecosystems. So I'm not quite sure we'd want to eradicate them, whatever that means. New vaccines will make people healthier. Now, we do agree on the gap between rich and poor countries, but we might have varying ideas on how that should be achieved. And that this will be the last pandemic, unfortunately, I don't think Mr. Gates has the totality of the answer to that. So this is just rather strange, really. But anyway, let's not go beyond the information we have. You have the information from the videos. Draw your own conclusions from that, and do let me know what you think, and let's make this a matter for ongoing public debate. But for now, thank you for watching.